Well, according to Mental Health America, an estimated 54 million people are living with some type of mental illness or disorder in our country. A little closer to home, it affects 1 in 5 New Yorkers. So how do you improve mental health? Joining us now is Dr. Lloyd Sederer, Chief Medical Officer of the New York State Office of Mental Health and author of the new book, Improving Mental Health, 4 Secrets in Plain Sight. Welcome. Thank you for being here.
It's great to be here again. I was here a few years ago with a different book. Great to be back.
Welcome back. Let me ask you first, those statistics are so alarming to hear. Why do you think those numbers are so high?
The numbers are high because we're good at now uncovering and reporting the kind of incidence, prevalence of mental illness in this country, including addictions. So 1 in 5 people, children as well as adults, are going to suffer from mental illness in the course of every year. They're going to have some sort of functional limitation as a result of these conditions, which are not just very present everywhere, they're also very treatable.
Very treatable, which leads us to your book, which is short and easy to read for if you're in the field, you're not in the field, 4 Secrets in Plain Sight. Tell me, why did you want to write this book? I
wanted to write the book for anybody who was interested in improving their mental health as well as their health. And and what I tried to reveal are there are ways hiding in plain sight that don't require prior approval from your insurance company. They are free, they're actionable, they're things that we can all do now to have a better life.
So let's talk briefly about each. There's 4 of them. Let's start with behavior serves a purpose. What do you mean by that?
Behavior serves a purpose means that when we see someone or when we ourselves act in a way that we just don't understand, whether we smoke too much, drink too much, gamble too much, or as we see somebody who has trouble eating, losing profound weight, anorexia, or someone even who is psychotic, out of touch. We need to first start to understand what their behavior is doing for them, because it is serving them, not in a very good way, but the best way that they know.
So trying to put yourself in their shoes a little bit.
And sometimes to discover with them by asking non-judgmentally, what's going on here? How do I understand? I know you too think that this doesn't make any sense.
Right. The second one, power of attachment.
Yeah,
that starts really early.
Yes, it starts from the very beginning, and a whole foundation is laid in us for trust, for the capacity to have relationships with other people.
As a child, we're talking about.
As a child, and it's continuously evolves over time. And the power of attachment, I don't know if I'm allowed to say this, but attachment trumps instincts. We used to think in psychology that it was sex and aggression, even food, that dominated our behavior, but in fact it's relationships. It's the need for relationships
and
that
healthy
dominate.
connections.
And
you
healthy
write about.
Connections.
The third one, less is more.
Yes, so there's a long history in medicine and in psychiatry that if a little bit works, a lot more is going to work better. And that usually backfires. There's a whole history, cancer treatment, for example.
You talk about medication in the book.
Yes, and psychiatric medications a little bit works. And so people think, well, maybe I should take more. The doctor thinks these are well-intended physicians, but they're operating under an assumption that more is better when, in fact, less may be better. And this is important if you're a patient or a consumer, because you want to be mindful that often less is more.
And here's one that a lot of us can relate to. Chronic stress is the enemy, the 4th one.
Yes, so we live in an environment now where our whole stress system is continually raging. And what happens with that kind of stress is that it produces cortisol in our body, this inflammatory hormone. We lay down those fatty plaques in our hearts, in our brains, put us at risk for heart attacks and stroke, affects arthritis, and it's very associated with a lot of mental conditions like depression, PTSD, even schizophrenia. So we need to understand that there are things that we can do to quiet our body, to quiet that stress response, and that they're not necessarily medications.
There's so much in this book that we can't get to. If there's one thing that you want people who are watching at home to remember, what would that be?
It's that they should be hopeful, that there are a lot of emotional problems that we all face, whether we have a mental illness or an addiction, but that there are pathways to recovery. There are ways to make a life, and I hope that people get that message.
Doctor, thank you so much for being here.
Well, thank you
we
for having me.
appreciate it. And we have a link to Dr. Sederer's information, his book, of course, at our website, cbsnewyork.com. Also, if you or someone you know seeking emergency mental health counseling, you can call or text the city's mental health hotline. That's 188-NYC-WELL. Counselors are available around the clock. And we'll be right back.